Well, we've previously discussed how the need to understand shell shock in wounded veterans helped to reshape the modern profession of psychology. With Remembrance Day upon us, it seems appropriate to discuss our more modern-day understanding of post-traumatic stress disorder, or PTSD. And here to discuss with this week's Get Psyched with Dr. Janine is Dr. Janine Hubbard. Thank you so much for joining me a little earlier in the broadcast tonight.
That's all right. Flexibility is the name of the game.
Absolutely. So why don't we start with dispelling some common myths for us?
Sure thing, because although things have definitely evolved, there's still some misunderstandings out there. And I think I've given you a couple of the most common ones.
Absolutely. So do you need to have been in active combat or be in the military to experience PTSD?
Absolutely not. And that's probably one of the biggest areas of research and clinical implications that has come about. We started with the veterans, still applies to a lot of the veterans, but applies to a much wider swath of the population.
Another one, did you need to personally experience a life-threatening event?
No, and again, this is a common misunderstanding. It needs to be your life was at risk, but maybe it was something that either you observed in someone else, you are knowing that family members are experiencing, perhaps from afar, or just the fact that you were present in a situation that could have led to something catastrophic is, we now realize, is enough to lead to PTSD symptoms.
Does everyone who experiences a traumatic event develop PTSD?
No, fortunately, and again, we're still understanding a little bit about the factors that put people more at risk or less at risk, but certainly there are a lot of symptoms that we expect to see for the first couple of weeks. Things like you might see disrupted sleep, avoidance of the situation, you might see some hypervigilance, you might see some mood changes, some withdrawal, perhaps some numbness. Those are all really common, but we expect them to resolve in about a month.
So why is it then important for us to be having this discussion now in the relatively safety of Newfoundland and Labrador?
Well, partly Remembrance Day is a really good acknowledgement because we do know that individuals in our armed forces are at risk, no question. And I know that the supports and services and awareness there has really increased. But we have members of our population that might not realize risk. Certainly, we've had a lot of recent refugees who have come from war-torn situations. The current situation in the Middle East is directly affecting many people in the province in terms of extended friends and family, relatives, but also just historical experiences. And so it's time to start looking at maybe there are people out there who do not realize that this is something that they may be experiencing. And so that's really why I wanted to raise it today.
How do you recognize it?
Well, like I say, it's looking back, and sometimes it's one single event, sometimes it's a series of events that can happen, and really you're looking for those changes. And when I talked before about that kind of 1 month period, what you often then see afterwards is actually the symptoms getting worse, so that you start to see things that are interfering with your relationships, with your work, with your self-care. We talk a lot about looking for behavioral and emotional changes, and this is one as well. But what we often see is people who may have experienced something many, many years ago and either brushed it off because, again, our understanding wasn't as solid, or kind of went, oh, well, I was fine, I wasn't at risk. And it's only when they start to reflect back and realize, you know what? I've never really been quite the same since that incident or since I experienced those things. And it's never too late to talk to your healthcare professional. It's never too late to start reading up on it, because the good news is we have really effective treatments. There's a number of them out there. And so you want to make sure that if this is something you're worried about, please reach out.
So, how can family members then help support a loved one with PTSD?
Oh, that's huge because unfortunately, family members are often the first targets of the anger, the irritability, the unpredictable behaviors, or the withdrawal, that inability to, be around and socialize and have those conversations. So certainly, we actually recommend family therapy. We recommend therapy for other members of the family, partly to help understand what it is their loved one is experiencing, and as a family, working on changing some of those patterns to, like I say, just bring it first and foremost into people's minds and understand that it's not necessarily a deliberate reaction, that it is part of a much more complex condition.
You know, there could be many, many people watching tonight that recognize this in their loved ones or in themselves, but maybe if they recognize it in themselves, they may not be willing to come forward. So what would you say to those people?
Well, this is again why this kind of format is so important, to be able to really normalize a lot of these experiences. We're now recognizing that there are many professions that put people at risk for PTSD. Our understanding is such that we want to make sure people know it's not anything you did. It's not anything that's your fault, but it is something that is treatable and can be life-altering with the right treatment and the right supports.
Dr. Hubbard, thank you so much for coming in.
Anytime. Thanks, Tony.